why would you give a menopausal woman Adderall? So Adderall is a drug that typically we see being given to children, even adults, but specifically for women in menopause, it's because of why. They're complaining they can't think straight, they've got brain fog, they can't concentrate, which is a symptom associated with menopause. I had a woman come into my clinic, and brand new patient, and she was on Adderall, had never been on it until a couple of years prior, and she's in menopause. And it was for that exact reason. She says, I have to concentrate at work, I was having trouble, and so my doctor prescribed this. And so you go, okay, fine. What should be your next question? What are the side effects of Adderall? The drug is extremely addictive. It can give you a high, and so hence the addictive quality. But also it increases anxiety, it decreases libido, it can increase your blood pressure, it can cause constipation, it can increase your risk for heart disease. What am I forgetting? Headaches and dizziness, and insomnia. So, and then, well, hi, Las Vegas, thanks for joining. So what's interesting is that a lot of the symptoms, decreased libido, fatigue, trouble with sleep, these are things that women with menopause suffer with anyway. So why are you giving a drug to exacerbate it versus get to the root cause? This particular woman was already on 5 other medications. I mentioned it can increase blood pressure. She was on 3 medications for blood pressure, and she was on an anti-anxiety medication. She had terrible constipation. So here we go, right? So here's this drug that, I think it can make me concentrate better at work, yet you're missing the fact that it's worsening all the symptoms that she's already on 5 different medications for. And that is where our healthcare system is really failing us, putting somebody on an addictive medication versus getting to the root cause. So what we do know, estrogen reduces, what happens is that your mental clarity goes down, your memory can definitely suffer, loss of concentration, but the other really important thing that happens with reduced estrogen is your risk for Alzheimer's goes up. Now, is Adderall giving you estrogen? Is it balancing your sex hormones? Of course not. So what we do here by getting to the root cause is seeing what are your hormonal levels exactly, and whether it's bioidentical hormones, whether it's herbs to increase the production of estrogen. Once you're in menopause, your ovaries are not producing estrogen anymore, but your adrenal glands are. But if you have anxiety and trouble sleeping, likely your adrenal glands are not functioning the way they should, which is why it's so important to look at the body as a whole and address the body as a whole. And it's just such a classic example of how we don't do that in this country. And so for menopausal women, it's not just about, my libido's down or my cognitive health is not the way it should be, but it's really about balancing these sex hormones for the rest of our lives. It's not just about bone health and heart health, which it is, but cognitive health. And this is not just for women, this is for men as well. So the cells of the brain have receptors, men and women, for our sex hormones. So if those sex hormones are diminished, then what's happening is you are not getting the cognitive health that you should, and not only the risk for Alzheimer's, but dementia, just cognitive decline overall. And there's no reason for it. There's absolutely no reason for it. So if this is you, or if this is somebody that you know, you're very welcome. I'm being thanked for the topic. It's really important to know what your tools are. And I could go on and on. I had another new patient this morning. I'm going to save that for tomorrow. But it's very important to know what our tools are, because these bodies are designed to live for over 100 years. It's 120. Sometimes patients freak out when I tell them that. But they're designed to live for over 120 years, right? Over 100 years. And that's by design, meaning that all the body parts, can go to that length of time effortlessly. Not that they're flagging, but they're doing this the way they should and functioning optimally. And So by the time you hit menopause around age 50, on average, some women a little sooner, you have more than half your life in front of you that you deserve to have cognitive health, and you deserve to have great energy and great sleep. So we can absolutely help with that, but these quick fixes that sound good, like these drugs, know the side effects of your drugs. I beg you to really look at that and ask your doctor about that. And a lot of times they'll kind of, slough it off saying, well, drugs have side effects, it's not that bad. Your body deserves you to do due diligence on these side effects and know that there's an alternative. So we'll see you tomorrow, and I'm glad you enjoyed the topic today.